Hello everybody, welcome back. Today I'm going to be going over periodontal disease. Now, what is periodontal disease? Periodontal disease is a bacteria that exists in your mouth. It comes from the plaque that you get throughout, when you eat, drink liquids, juices, things like that. It's a white substance that goes into your gut and falls in your gums and your teeth. And with time, if not taken care of, if not clean on a daily basis, it's the one thing that causes cavities and also periodontal disease. So periodontal disease, what it is that it's a bacteria that goes in through your gums and in between your teeth and your gums, and then goes into your jawbone, which is what's underneath your gums, and then it starts decaying the bone that holds your teeth in place. Now, this bacteria, when it does this, is, technically speaking, it's a lot more dangerous than having a cavity. The reason why is because technically it's much more dangerous than having a cavity. The reason why is because it's attacking the one thing that holds your teeth in place. So it's the same thing as taking the dirt out of a tree or removing the foundation from a house or building a house without a foundation. It doesn't matter how strong they are, how nice it is, how much it costs, how beautiful it is, they are going to fall over, and it's because they don't have the foundation. And now your jawbone, which is all the bone underneath your gums, again, is what supports your teeth. A lot of people have the misconception that it's your gums, and it's not. Like I said prior, your gums protect your jaw from the regular daily elements, cold, hot, sugars, acids, carbs, things like that, that these bacteria tend to consume. So your gums are a protective barrier for your bone of that. Your gums is what protects your jaw from those things. Now, how is it that people get periodontal disease? There's various ways of getting it. The three most common ways are, obviously, if you don't take care of your mouth. So if you don't brush on a daily basis, if you never brush, the plaque kind of builds up in your mouth, it forms tartar, and then you get periodontal disease. That's normally what most people know in terms of how to get periodontal disease. The two second ones, which are more frequent and most people don't know, is that one, you can get it from somebody else because it does transfer from person to person via the saliva. What happens is, and it doesn't necessarily have to be your spouse or your girlfriend or a boyfriend or husband. You can also get it from your regular family members. Because it transfers via the saliva, you can get it from sharing a cup, sharing utensils, and things like and like, for example, with Hispanic families and even a lot of European families, we have a tendency to also kiss each other on the lips. So you can get it from your cousin, from your uncles, anybody, your parents. It's very common for children when they're young to grab their father or mother a spoon or fork, or even drink from the same cup as their parents. It's a very common thing. And then these things happen continuously, on top of not having regular hygiene, and they get periodontal disease. And kids normally will get it at a younger age. I've had patients here, the youngest patient that I've had here was 16 years old, and he had periodontal disease, which is not a common thing. It is very rare, but it can happen. And then I'll have most of our patients will get, they'll have periodontal disease in their 20s, in their early 20s, sometimes in their mid 20s, which is not something that they should be having, and they fall into a situation where they're in danger of losing all their teeth at such a young age. So this is why periodontal disease, in my opinion, is much more dangerous than a cavity. Because a cavity it's normally on one tooth at a time, but periodontal disease, you have it in your entire mouth, and then that's one thing. The second thing, which is the most dangerous thing about periodontal disease, is that periodontal disease is a pretty much almost a no symptom sickness, disease. And the reason why is because periodontal disease does not cause, you don't have any pain, you don't have any discomfort, you don't notice it because you don't have, you can't see like black spots and things like that, like if you had a cavity. The only two symptoms that you really get are, one, your gums bleed when you brush your teeth normally, or they just bleed on a daily basis, depending on how advanced the periodontal disease is. And two, which is when you're in an advanced situation, your teeth start to move, they become movable, they start to get weakened. So like, you might be able to move a tooth and it'll be like, it'll just slightly move. That normally is because of periodontal disease. Now, the thing with the reason why I say it's almost a non-symptom disease is because those two symptoms can also be caused by other things. So bleeding gums, if you have diabetes, if you have cancer, can also cause it. Like if you're in chemo and things like that, there are medications that can cause bleeding gums. It's not something that's completely specific to periodontal disease. And with movable teeth, if you have an accident and you bang your tooth in the area, or if you're a boxer, if you're into sports, especially contact sports, any of those things can cause your teeth to become mobile, which again don't have nothing to do with periodontal disease. Is essentially a symptomless disease, for those reasons that I mentioned. Now, how does a dentist find out a person has periodontal disease? Well, there's various ways of finding out. One of them is that they do what's called a perio charting, and a perio charting, perio, it means gums. It's everything that's around the tooth, which are your gums. So what they do is that they have special instruments. They have a special instrument that it's kind of like it measures the depth, the spacing between your tooth and your gum. So how much loss you have there. And they measure every teeth independently in every section of the tooth. There's different sections to your teeth. And they see how deep the separation is between the gums and the tooth. And then also with x-rays, when they do x-rays, you can see the bone loss that's going on underneath the gums, as well as when a person first comes to the doctor, if they've never had a periodontal scaling, if they've never had anything taken care of in reference to their gums, you could actually see on the x-rays the tartar and the plaque that's accumulated underneath the gums. And that area is so, that the tartar and the plaque, it's so hard that it actually pops up on the x-rays. So normally, and then as well on the x-rays, you can, like again I said, you can see the bone loss that's there. So that's essentially how a dentist can determine if somebody has periodontal disease or not. And then in those situations, the one thing that they want to do is that they want to get what's called the scaling and root planning, or more commonly known in people is a deep cleaning. So I have a model here that is specifically to show how periodontal disease works. So normally everybody, what they see is that this is how they see their mouth. They see their gums, they see their teeth, and they go, I'm fine, there's nothing going on, I don't have anything else. So underneath your gums, like I said before, you have your jawbone, which is here. It's all the bone that's underneath your gums. And normally when a doctor does an x-ray, what they're looking for is, not only are they looking at the tooth, but they're also looking at the bone structure that's underneath the tooth. And when they do x-rays, normally you don't see not normally, but you never see the gums anymore. What you do see is what's underneath the gums, which is bone. And then this is what they see. They'll see bone loss. You'll see the tartar here accumulated on the teeth, which when you put the gums over it, you don't see anything. You don't see anything. You can barely see anything. And this one, because there's a what's called gum recession. After you have bone loss, your gums actually start moving down, which is why you'll see older people, they have their gums, their teeth seem a lot longer. The reason why is because they have bone recession underneath their gums, because they more than likely have periodontal disease, and that causes the gums to recede. Another thing that causes the gums to recede as well is if you brush your teeth really hard. So if you use a toothbrush that's hard bristled, and you brush very vigorously, you can actually cause your gums to recede as well. So periodontal disease is not the only cause for that. That's also another reason why. But for the most part, it's related to periodontal disease. Again, when the dentist looks underneath, he's looking to see what it looks like under here. Okay, and then when you have a lot of bone loss, and you start having this amount of bone loss underneath your gums, your teeth start to become mobile. And that's normally, when that happens, that's a sign that a person has very, very advanced periodontal disease. So essentially, that's how a dentist looks inside. And then when they do measurements inside the gums, that's essentially what they're looking for when they do the measurements. But yeah, going back into the gums, this is essentially what the dentist is looking for. So when they do a scaling and root planning, what they're doing is that they're removing all that accumulation that you have in your teeth attached to your teeth, and it's eating up your jawbone, your bone structure. So going back to gums and periodontal disease. So a dentist normally, what I said before, they do what's called a scaling and root planning. And a scaling and root planning, in essence, is them cleaning inside and removing all the tartar that you have built up underneath your gums, between your gum and your teeth. And what happens is that when that happens, your body naturally starts to heal itself, because your body actually does detect the periodontal disease. And what happens is that that's why your gums start filling up with blood, because your body, what it's trying to do is that it's trying to push out that infection. And when it starts to fill up your gums with blood, so normally when you brush your teeth, you'll have that blood that's trying to fight the infection off, push it, it seeps out through your gums. Your body doesn't succeed, because if it did, then nobody would have periodontal disease. So again, yes, your body, when the dentist does the deep cleaning and then the regular cleaning, your body starts going into this healing process. And when it goes into this healing process, it takes time. It's not something that happens immediately. Periodontal disease takes a very long time to get to where your teeth start getting loose. So it'll take time for the gums to reattach themselves to the tooth, to reduce the amount of separation you have between your gum and your teeth. And normally when a person has periodontal disease, now they cannot go to the dentist minimum 2 times a year. They have to go 4 times a year. And if the dentist requires it to be more frequent, depending on your situation, then it just has to be that way. But for the most part, perio patients have to go to the dentist 4 times a year, as opposed to just 2 times a year. And the reason why is because of that accumulation. Because once he cleans everything out, you still have that separation between the gum and the teeth. So for example, this is your tooth, and then this is your gum. So you have this pocket that's there where all the tartar and the plaque and everything gets stuck inside. And it needs time for the gums to reattach themselves to the tooth. That takes time. So when you go to the dentist, on top of him doing a regular cleaning, in this occasion, because you're a perio patient, every 3 to 4 months you go, he also checks inside, and whatever accumulation you have, he cleans out as well, to maintain your teeth, your gums, in that healing process. Now there are certain products that help with healing up your gums. You have laser surgery for your gums for people that have periodontal disease. We have a system that we use called PeriProtect, which I personally like a lot, because it's something that you use in your house. You take home and you use it in your house on top of brushing your teeth, flossing, mouthwash. Hopefully you guys are doing all three. You also use this tray that is specifically to help clean your gums. Now the benefit and why I like it is because you use it on a daily basis. This is not something where you come to the dentist every 3 or 4 months, because the thing is that, personally me, I don't well, everybody does it, and dentists do it, because you assume that patients are taking care of themselves, and you would hope so. I personally would hope so. But I mean, the truth of the reality is that when a patient comes to a dental practice, if they have periodontal, if they have cavities, if they have things like that, it's because their routines at home are probably not that optimal. Now, it's not necessarily true for everybody, because there are people that just, they might have, their body might be weaker, so they're more, their enamel might be weaker, so they're more prone to cavities, or, they might have gotten periodontal disease from when they were younger, and they just didn't know. Lack of knowledge is a really big situation when it comes to these problems that you have in your mouth. So I'm not going to say that it's like entirely a routine thing, but for most people, it is, because most people honestly don't brush their teeth 3 times a day. Most people don't. The grand majority of people don't floss. They feel like it's too time consuming. Everybody uses mouthwash for the most part, because I mean, it's just, you just put it in your mouth, gargle a little bit of bubbles a couple of times for a couple of minutes, spit, and then you're done. You're good to go. So that's unfortunately, that's the reality of the thing, and we here have to take it that way. So the one thing I like about this is that, because a person has their regular habits when they leave the dental practice, and even before they come in, this kind of sets a new habit for the person. So because they have that added habit, and they're more forced to use it because they don't want any other problems, it might lead to them to maybe brush their teeth more times a day, to maybe use floss the next time, and it changes their routine into something new. And changing routines on a daily basis, it's what leads to success, especially good routines. So that's why I like Perio Protect. And now, it doesn't necessarily mean that you have to do only that. You can, again, there's different methods, there are different things that you can do, and every one of them has a separate cost. So another thing about periodontal disease is that periodontal disease is not something that once you do the cleaning, it's gone forever for the rest of your life. You actually have it forever. Periodontal disease, once you have it, it's in your body. The bacteria is always there, and it's going to be there forever for the rest of your life. but it's different than, let's say, for example, mono, or a more common thing known herpes. Like once you have those sicknesses, you have them for the rest of your life. They live in your body. They're dormant, um, for nobody knows how long. It could be a month, it could be a year, it could be 5 years, it could be 10 years. It's whatever. And then the sickness, the virus comes back and activates itself in your body. I'm not a doctor, so I don't know if it's a virus or if it's bacteria or what it is that's in your body in terms of, herpes, for example. But it activates itself, and then you get it again, and then you have to go and take medication. You have to, do things to get rid of it so it can become dormant again, but it's still in your body. Periodontal disease is the exact same way. The only difference is that it doesn't come back whenever it feels like it. So long as you take care of yourself routinely, you're always, being informative with your dentist. You go to your visits, your routine visits throughout the year to the dentist, and again, you make new habits when it comes to your oral hygiene. You doing these things can prevent it from it coming back forever. But the moment that you don't take care of yourself, the moment that you get lazy with your oral health, you stop going to the dentist, things, then it will come back, and unfortunately, in most occasions, it comes back even worse than when it did before. So that's really the issue, the thing with periodontal disease. Now, the one thing that I have a lot with patients is that they tend to say, everyone has the thing of like, well, if I don't feel any pain, then I'm perfectly fine, because I don't feel any pain. And you don't want to fall into that habit. The reason why is because cancer, for example, does not cause any pain throughout the entire process, the entire time, until you be like, hey, I have a ball. For women that have breast cancer, they be like, I have a ball here, and we go to the doctor. That's kind of like either it's already a midpoint, or you're in an advanced state, and you want to prevent that from happening, and you normally don't feel pain. Once you get into the advanced states, that's when you start feeling pain. You're like, oh my God, I'm in so much pain. Your mouth is the same way. Cavities, it's like, well, it doesn't hurt, so I'm fine. But then it starts to hurt, and then you have to get a root canal. Or or your gums are like, well, I don't feel any pain, it's fine, I'm perfectly fine. And then your teeth start to fall off, and you're like, oh my God, what's going on? Why is this happening now? Well, it hasn't been happening now. It's been happening for years. And you're at a, either I take care of this now, or everything, or I'm dead, if cancer or whatever. Or I'm gonna lose all my teeth, or I just don't have a choice. My teeth are already gone. I'm gonna lose most of my teeth, and now I have to get a partial, or I have to get a denture, or if I have a lot of money, I have to get implants. But it's all an expense, and it could all have been prevented by taking care of yourself, and also by going to your dentist, or if it's a medical condition, going to your physician. So it's very important. It's very, very important, and it's very undervalued. The having to take care of your oral health on a daily basis. It prevents a lot of problems. It prevents a huge cost on your pockets, things that you can spend on other stuff like your family, going out with your spouse, going out by yourself, traveling, being able to pay your bills. It's something that it's an unexpected expense that you want to prevent, and it's very preventable. And it's as simple as just going to the dentist for your routine checkups, and taking care of yourself in your house, and teaching your children to do it as well. Because if you teach your children, they'll also prevent having to have a big expense when they get older, and then you're gonna prevent an expense as they're growing. When they go from their baby teeth to their adult teeth. Because remember, we all have just one set of teeth. Once your adult teeth come out, those are the only teeth you have. We're not sharks. We're not beavers where their teeth, we're not rats, we're not squirrels where their teeth just keep elongating over and over again. That does not happen to us. We unfortunately only have one set of teeth, and once they're gone forever. So that's the entire thing on periodontal disease. The next thing I'm going to be going over, which a lot of people are probably going to be excited about, is implants. And the reason why I want to leave this to after periodontal disease is because with implants, I'm going to go over what are the benefits of implants, and as well as what happens to a person who has periodontal disease and decides to get implants later in the future, and what to do to prevent yourself from losing your implants if you have periodontal disease, or even if you don't, and what to do in terms of cleaning it. Because just because you have something that is not part of your body, like a metal or anything, it does not mean that you don't have to take care of it and that you're done, it's all good forever. Like, so I have people that have dentures, and they're like, oh, I have dentures, I don't have to worry about anything, everything is fine. No, there's a lot of things that you have to take care of, even more so now than you did before. So again, I'm going to be going over implants. So for the meantime, everybody, it was good seeing you guys. Have a good day, and as always, flourish and prosper.